and welcome back. Are you planning to marry anytime soon? Well, did you know that understanding your partner's health is also an important aspect of any union that shouldn't be ignored? On this episode of Health Digest, Gloria Milimu explores some of the essential medical tests doctors recommend for couples, what they mean and why they are an integral part of any union and its future. Take a look.
When people enter a union, they do so without the intention or anticipation of any health complications. After all, marriage is considered a lifelong union, and the embers of love during weddings or engagements never indicate that sweet emotion and feeling could ever be replaced by something else that could impact on the health and even the future children the two lovebirds may have. While knowing your partner's health is as important as other factors we often consider before embarking on the happily ever after fairy tale, doctors say one of the most overlooked aspects of most unions is health. It's not just about knowing your partner's HIV status. There are several medical tests that doctors say can help you identify potential health risks, compatibility issues that have the potential of affecting your ability to have children, and even genetic or hereditary diseases that can impact on the health of your future offsprings.
Most of them want to
Dr. Kireki Omanwa, a gynecologist and fertility expert, recommends that couples should consider getting a fertility test done if they intend to have children. These tests can range from checking fallopian tube function to analyzing the quality of sperms.
Checking the tubes is very important, and that test is called HSG. And this is done by our colleagues who are radiologists, whereby through a small instrument, they pass what we call a contrast through that instrument, and that contrast is supposed to go through the cervix, it goes through the uterus, and is supposed to spill out if everything is okay. As that contrast goes through the uterus, they take X-ray pictures. They take 3 or 4 X-ray pictures, which later on we can analyze. And in that analysis, we can actually ascertain whether the tubes are okay, they are open.
Similarly, checking for hormone function of at least 3 hormones that play a critical role in the reproductive cycle is also recommended.
The first hormone is called prolactin, and prolactin basically makes a woman's breast to produce milk, especially when she's expectant. Now, sometimes prolactin can be elevated even if a lady is not expectant. If that happens, the body thinks that there is a baby, so that woman, even if everything else is okay, she cannot get pregnant. The other one is called TSH. Now, if the TSH is elevated or is not, or is the level is lower than it is supposed to be, what will happen is that the body will not be functioning the way it is supposed to function, and hence chances of getting pregnant are also very low. And then the last one is called AMH. The level of this hormone gives us an idea about ovarian reserve.
For men, he recommends a sperm analysis, which evaluates the quality of the sperm, its shape, and even movement. Knowing your partner's blood group can be among things that couples can easily overlook. However, Dr. Omanwa says that blood group compatibility test is an aspect that couples should not ignore, as it can help prevent complications during pregnancy.
If the lady has negative, what we call rhesus negative blood, for example, she has B negative, and the husband-to-be has, let's say, A positive, it means that if the lady was to get pregnant, and if that baby is carrying the blood group of the father, that is A positive, the lady's immune system can recognize that baby as an enemy, and then it will send what you call antibodies to fight against that baby, and actually can lead to either a miscarriage or sometimes the baby can have complications as well.
Other tests doctors recommend include testing for HIV, hepatitis B and C that affect the liver and can spread through bodily fluids, sexually transmitted infections like syphilis, diabetes, hypertension, and tuberculosis, among others. Screening for genetic disorders like sickle cell is also advised, as it ensures couples are aware of the potential hereditary conditions that may affect their children.
Other diseases also, for example, like hemophilia, if there is a history of that in the family, it can also be checked just before getting married, such that this couple, when they get married and they're going to have children in the future, they are aware.
While there are no legally mandatory medical tests required by the government for couples to get married or cohabit in Kenya, countries like Oman have made premarital medical examinations mandatory for its citizens. The tests focus on hereditary blood disorders like anemia and thalassemia. In Kyrgyzstan, lawmakers proposed a new bill that could make health screenings mandatory for couples before they tie the knot. Egypt is also among countries that have explored this route, proposing the screening of at least 10 conditions before marriage.
From where I sit, I think these tests, number one, should be included prior to getting pregnant so that we know where we are. And then also, once a lady has got pregnant, of course, they must be included, and they are included in what you call the ANC package.
In order to help couples know the importance of taking these tests, Dr. Omanwa recommends that religious leaders who mostly officiate these unions should be roped in the conversation to help encourage the couples to get the test done prior to tying the knot. Gloria Milimu, KTN.